UTIs, the silent killer of aging parents. Caregivers need to be alert for these signs and symptoms that I'm going to talk about today so that they'll know that this is the hidden cause for the problems that their parent may be experiencing. As a nurse for 30 years, I get calls all the time telling me about their loved one and the fact that they're having all of a sudden these new problems. And the caregiver is usually just so frustrated and mad at their loved one for their behaviors, not realizing that the missing ingredient is probably a UTI. So, what are those symptoms? Let's get right down to them. The first thing to be alert for is incontinence, not just the normal incontinence that they maybe experience that they've been having for a while, but actually increased incontinence. Maybe they usually have a little bit of a trickle, but they still can make it to the toilet. But all of a sudden, they stand up and just pee goes everywhere, or they're peeing all over the bed. And these are not normal behaviors. That makes me start thinking, hey, maybe there's something going on. What is it that's going on? Unfortunately, a lot of caregivers don't know about that it could be a UTI, and so they just think that their loved one is being lazy and refusing to get up and go to the toilet. Number two sign to think about is pain, and not only pain with urination, but pain in that lower abdomen and or in their back under their ribs. And somebody who has some dementia might not be able to verbalize to you that there's pain going on when they urinate or that they're having these other pains. But maybe when they sit on the toilet, if you observe them, you might see them kind of puckering their face or saying, ow, but then they don't tell you about it later, so you just forget about it. But that's a sign that there might be a UTI brewing. The next thing to think about is frequency, increasing going to the bathroom. When they're always asking, you just took them and now they want to go again. And you think, would you just stop bothering me? As a caregiver, I've got tons of other things to do. And you're just irritated because you just took them 30 minutes ago. Why are they asking again? And so then instead of thinking UTI, you think, okay, fine, I'm not going to give you any fluids for a while. I got to get things done. So remember, could be UTI. And maybe urgency, like they usually can say, I need to go to the bathroom, and then they'll make it to the bathroom. But now they've got to go right now. They can't wait the 15 minutes it takes to call you to get up and to go into the bathroom. This is a frequent cause of falls that I've seen, is somebody who has a UTI who now has urgency and they just can't wait for someone to help them, and they try and get up on their own, or they're rushing to the bathroom. In either of those scenarios, the terrible thing that sometimes happens is that they fall. So the next thing to know is that, hey, maybe you have ordered the little dipsticks from Amazon. You can order those and see what is in their urine. You have them pee in a little cup and then you dip it, just like when you go to the doctor. This is a great, easy, simple way to check and see, is there anything brewing in there? And what you're looking for is positive leukocytes and positive nitrite. But the thing to remember is that sometimes people always have a low level of bacteria in their urine. It's called a colonized bladder. And the thing to remember is that don't be checking for this colonization when they don't have symptoms. So just because they have a positive dipstick doesn't mean they need treatment. You've got to make sure that they've also have symptoms and that there's a reason, because you don't want to have too many antibiotics, because too many antibiotics can lead to that colonization of the bladder, and that'll just make things get worse and worse. So what can you do to help combat this? Maybe they don't actually have a UTI, or how can you make sure that they don't get UTIs in the future? One of the great things to do is time toileting. So I've had patients that were living with me and they didn't want to be bothered with getting up to go to the bathroom. And so they restrict their fluids, or they just sit there and hold it all day long. And I discourage that because that makes it easier for the bacteria to grow. So make sure you're helping your loved one get up and go to the bathroom on a regular schedule, at least before meals. Um, they shouldn't need to go every hour. Every 2 to 3 hours is a good range, but make sure that they're doing that time toileting to help decrease problems with urgency and frequency. The next thing to make sure that you're doing to help them avoid UTIs is to push fluids. Make sure they're drinking lots and lots of fluids, especially water. Lots of sugar drinks will actually lead to more UTI problems, is what some of the research says, because you've got all that extra sugar, and bacteria love sugar. And so sometimes people say to prevent UTIs, drink cranberry juice. The only problem with that recommendation is that cranberry juice tends to be high in sugar. And so you're kind of helping on the one hand, but maybe making it worse because of the sugar on the other side. So cranberry pills are a better idea. But back to those symptoms that we were experiencing earlier. So if your loved one is experiencing all of that combination, the incontinence, the pain, the frequency and urgency, then you need to make an appointment with your doctor or with an urgent care and get a check. The other symptom that a lot of times people don't realize connects to UTIs is confusion. And this can happen in the dementia patient where they have increased confusion over their normal level. And it is oftentimes the first signal that I will see in the patients that I am helping. And when I start seeing someone who is just way more confused than normal, I start thinking, are the other symptoms evident? Are they having other issues to make it look like a UTI? Because there's other causes of dementia also. So you don't want to confuse and give an antibiotic every time they get confused. But it's something to always think about. Why are they having that increased confusion? Why are they more incontinent? And so those are all things to really think about with your loved one, and don't just jump to the conclusion that they're trying to be difficult. Instead, think about, could this be a cause, whether they have dementia or don't have dementia? Because the thing is that UTIs are more common in older people because either they're female and it's a decrease in hormones. So a lot of times one of the things that can help with UTIs is to actually have a topical estrogen cream. And that without that cream, without the estrogen, women tend to get more susceptible to UTIs as they age. And then men also have problems because of enlarged prostates, and they end up with some urinary retention going on, which leads to a environment that allows the bacteria to grow. So it's important to think about treating these UTIs. You don't want to treat all the time because then you get antibiotic resistance. But go in when you have symptoms and get a treatment plan for 3 to 5 days of antibiotics, depending on what your doctor orders. Failure to treat UTIs can lead to sepsis, so a infection that goes throughout the body, and can even lead to death. So unless the person is not wanting antibiotics anymore, this is definitely something to think about and always have in the back of your mind, especially for people who have dementia who can't verbalize to you that they're experiencing symptoms. But even in my people who don't have dementia, oftentimes people fail to tell me the symptoms. And it's only when I take a step back and look at the whole picture that I realize, oh, they're having symptoms. And when I put them all together, that's a UTI. And usually the best solution is to go and have a urine culture done to check and see what antibiotic is the best and to see what can be done. And that's all done at the doctor's office or in urgent care. It's not usually an ER thing. It can usually wait until morning, and that keeps you out of the hours and hours long wait in the ER. If you want more tips, I have a easy caregiving guide. So make sure you type tips in the comments down below. And I would look forward to seeing you in one of my other videos that helps you care for your elderly parents.